Well, I'd like to say welcome tonight. I am so excited about tonight. I know that you guys have many busy schedules and you have a lot of things to do, but you decided to come out to hear me tonight talk about Botox. Now, I know what you're thinking. A dentist doing Botox. Are you kidding me? A dentist doing Botox? Well, let me explain something to you. It makes so much sense that a general dentist is now performing Botox. We've been performing or providing needle injections for years, since the beginning of back in the Western days when a general dentist was a barber, and then he became a specialist in everything he's done. So it's a make sense type of situations that general dentists are moving out of the mouth and on into the face. Over time, what happens when you consistently squint, you frown, or you squint your eyes up here, the delicate facial muscles that are located underneath your skin decide to get big or kind of like create wrinkles in this area here. Some of the purposes of or the uses of Botox is to create a more relaxed look to you, giving you more of a youthful appearance instead of that constant wrinkle or squinting look. There are times where some patients come to me and say, you know, doctor, I'm always looking angry, but I'm really not angry. It's just people will address, are you mad? Well, that's because over time, what happens, once again, those delicate facial muscles will constantly contract. And what the Botox would do is kind of relax those muscles here and over here. And also heavy smoking at times as well will create wrinkles too. So now, the other areas that we might want to consider focusing on is what's called the frontal muscle. Heavy wrinkles from up top here. What we would do is place a couple units here, 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 and here. And what that would do was give you more of a smoother appearance. Now for the crow's feet, when we actually like to place 3 different types of units here. One here, and one here. This will basically help release or give you more of a smoother appearance so you don't look like you're squinting really hard and such in here. The other appearance that you like to think of using Botox as, or a location would be, is what you consider the bunny smile. You have a hard or heavy pull right at this muscle at this location right here, give you that bunny smile. And actually what you do is place a couple of units here, a couple of units here as well. We'll reduce that. Some of the other areas that you might consider placing Botox will be located at the nasolabial fold here, the nasolabial fold here. But in this area here, you'll be using what you call derma fillers. In derma fillers, you actually just fill the area up here. Fill it here. Now, some of the other areas that you can use Botox or derma fillers, you can use what you call the marionette lines, which are located here and located here. Just filling those areas will allow you to turn your frown to a smile. Some of the other areas, once again, we talked about temporal mandibular joints disorder, which is the temporal and mandibular joint here, where we actually place temporal Botox right here, and you place it right here. Therefore, we give you not a smoother appearance, but to decrease the clenching which happens from that muscle. Now, will it paralyze you from eating? No, it will not. But it will deal with relaxing the muscle, decreasing the migraine headaches until you're able to see a temporal mandibular joint specialist.
He's growing in his practice, not just for dentistry, but branching out into other things, enhancing his knowledge and what he's able to give to his patients, and making it a one-stop shop.
I feel that I have like these parentheses right here when I smile, and when I'm stopped smiling, you still see the lines there. I don't like that.
When I go to any kind of facility, I look at the environment. And if the environment is not right, I wouldn't be back. So if you see, I'm back.
With Botox, there's lots of ways to start the procedure. What we like to do normally, pretty much, we use some ice right here and have the patient place ice right on the forehead, if that's the area that we're working on, or we have the place ice on the lips or wherever. And what that ice will do is kind of numb the area up just a little bit so you don't have to give anesthetic. So we're going to have the patient right now have the ice sit on her forehead for about like 5 to 10 minutes. Okay. The first thing you do when you place Botox on the patient here, you clean the area off with a little alcohol for your injection sites. Orbicular oculi muscle, which is located right here. If you place too close to this right here, what you're going to call is ptosis, or the drooping of the eyelids. So you definitely don't want it to be too close right here because the patient will have a drooping eyelid effect after the injection. So when you want to place the injection, you want to make sure you stay centered as best as possible. So you're going to place one injection right here, one right here, and one right here. Then you come back, squint one time for me please. Then you'll place your next injection right here at the corrugated muscle right here, and one right here. So you in total, you're going to have a total of 7 injections. So 1, 2, 3, 4, 5, 6, 7. And the reason you're doing that, once again, is going to relax these muscles which pull consistently. Okay? All right, so the first injection, we're going to have the patient squint one more time for me, please. Great. Then I'm going to pinch the area that I'm going to be working on. Now this right here is one of the strongest muscles in the top of the head. It's the procerus muscle. And I get my first injection here. I position myself for it. And you give your first injection right here. Good. You come back and you wipe off a little excess bleeding right here. That's it. Okay, so total injections that we have placed in the patient is, once again, one right here, here, and you place one here and right here. A total of 20 units that you place inside the globule complex. And what this will do pretty much is relax the muscles here and cause a relaxing effect and more smoother appearance for her. And to decrease the 1s, 11s, and the 3s for the patient. Once again, thank you for coming out this evening, and I hope you guys had a good time and hope to see you in the future.